talking about. All right, you ready to talk about MRSA? Let's get into it. Well, what is MRSA? Well, we know it's a certain infectious and or parasitic disease. We do know that because it's in this section, right? And MRSA is the acronym for Methicillin-Resistant Staphylococcus aureus. So it's a very difficult bacteria. It's a very difficult bacteria to treat, and it's resistant to penicillin or any kind of medication in that family. Now, it's in the title, methicillin-resistant. That's our clue. All right, now we have a couple of guidelines that I want to draw your attention to. Guideline C1E1A, when you are coding for MRSA, right, use a combination code for the infection and the causal agent. If there is a combination code, use it, right? Use it in lieu of B95.62. And on the left, this is what one of those combination codes look like. See, under Staphylococcus infection, underneath, you have methicillin susceptible and methicillin resistant. These are the combination codes. Well, we're only talking about MRSA, right? Resistant. So A49.02. This is a combination code that is related to a staphylococcal infection. All right. This is an example. Now, if there is no combination code, then the sequencing order is first you code the infection, then you use the general MRSA code, B95.62, MRSA infection as the cause of disease classified elsewhere. All right. Hopefully you understand that. And remember, don't code a resistance to penicillin with this B95.62. You don't code it with that. Don't code it with the A49.02 because it's understood, right? It's in the name. All right. I've got one more guideline to draw your attention to, guideline C1E1C. And this is MRSA carrier with no current infection. So if the patient is a carrier of the MRSA disease, use Z22.322. All right, so we're going to say MRSA bacteria. So if this patient is a carrier but doesn't have the infection, they carry the bacteria but don't have the infection, then there you go, Z22.322. And don't code it as having the condition. They're just the carrier. Now, let's go ahead and test your knowledge, right? Let's do it. We got our guidelines, and let's see what we can do here. Which ICD-10-CM codes best describe the above encounter? A, L01.419, B95.62, B, B95.61, L02.419, C, L02.419, Z16.11, and D, B95.62, L02.415. Barbara, a 55-year-old female patient, is admitted to the hospital with red, swollen, and non-healing abscess on her leg. The patient has been on an antibiotic for 7 days, and the abscess has not improved. It is now extremely painful and warm to the touch. The physician suspects that it is caused by MRSA. The physician orders a culture and sensitivity test to confirm the diagnosis, which came back positive for MRSA. All right, coders, Your time begins now. And don't forget, go to your guidance, your guidelines. Guidelines are your friend. All right, you all are doing amazing. Yes, indeed. All right, so I'm going to do my due diligence and I'm going to highlight my keywords. Red, swollen, non-healing abscess on her leg. Abscess. Warm to touch. Physician suspects MRSA, and it came back positive for MRSA. So inventory is red, swollen, non-healing abscess on leg, warm to touch, suspects MRSA, and MRSA positive. All right, so I think we have two diagnoses here. We have non-healing abscess on leg, and we also have MRSA positive. All others are integral. The redness is integral to the non-healing abscess on leg. The swelling, non-healing abscess on leg, and MRSA. In fact, redness and swollen or swelling are both related to MRSA and the non-healing abscess on leg. Warm to touch, related to both, and the physician suspecting MRSA is an indicator or indication that the patient may have MRSA. So these are my two diagnoses. All right, coders, can you eliminate anything on site? If you can, you are the bomb.com. I can't right now, but I can after this guideline. All right, so the guideline that I'm going to consult is C1.E1B. This is other codes for MRSA infection, and it says when there are no MRSA combination codes, code first the condition or that illness, followed by B95.62. This is the general MRSA code. And also it says do not use Z16.11 resistance to penicillin if the patient has MRSA. All right. I think this eliminating something right here, this Z16.11 is in answer C, and this can't be correct because the patient is positive for MRSA. Also, it tells you how to sequence. It says sequence first your condition, follow followed by B95.62. And if we look at D, D is not sequencing properly. It's sequencing the B95.62 first, followed by the condition, and that is incorrect. And some of you might say, well, I'm going to eliminate B too, but the guideline is very specific, okay? So let's not get ahead yet, not yet, until we know. So let's go ahead and let's look these up. And again, here's our guidance below, how to sequence when you don't have a MRSA combination code. All right, so we'll begin with L01. This is cutaneous abscess, furuncle, and carbuncle. All right, so we're in the right category. And if we go down, it says use additional code to identify organism. Look at that, additional code. That's a clue that you sequence it after this code, right? All right, now let's go down and look at our subcategory code, L02.41, cutaneous abscess of limb, and then L02.419, this is cutaneous abscess of limb, unspecified. Indeed, we don't know which leg it was, so we do have to use this code, and this is correct. Now, let's go down and look at the B95.6 subcategory. This is a subcategory for Staphylococcus aureus as the cause of disease classified elsewhere. But you also have B95.61 and B95.62. What is the difference between the two? Well, B95.61 is methicillin susceptible. In other words, the penicillin works. Yeah, so the penicillin works when it's susceptible, and it doesn't work when it's resistant, right? So one is called MSSA when it's susceptible, and MRSA or MRSA when it's not. So in our case, our patient has MRSA, so B95.61 cannot be correct. And the answer is B95.62, so we're going to eliminate B, and A is our answer. All right, coders, how you doing? That's right. Someone had some really good sayings in the chat. She said, A is the way to go. That's right. Good deal. Tell me how you're feeling. Let me know. I want to know. All right, I think I have one more scenario, then I'm going to have a brief chat about a couple of the other guidelines. Okay. Hey, someone said, hey, a lot of information. Guess what? It is, but you're going to get there. And through repetition, you're going to know it, right? Okay, here's the next scenario. Which codes would best describe the above encounter? Oh, hey, A41.9, J15.212, R65.21, N17.9B. A41.02, J15.212, R65.20, N17.9, and C, R65.20, A41.02, J15.212, and D, A41.01, J15.212, R65.20, and N17.9. A 70-year-old male injured his toe when he dropped a piece of firewood on his foot while wearing open-toe shoes or sandals. Over the past several days, the area has become red, swollen, and warm upon touch, and he has been unable to bear weight. His wife noticed the toe has purulent drainage. At his wife's insistence, he presented to the ED for evaluation. While in the ER, the patient began to complain of shortness of breath and shaking chills. His physical exam revealed faint rales in the left lung, and his temperature was 101 degrees Fahrenheit. A swab of the pus from the toe came back positive for MRSA. The patient's condition rapidly deteriorated, and he began to have decreased urinary output and function with lower extremity swelling and increased shortness of breath. Following labs, cultures, and chest x-ray, the patient was diagnosed with acute renal failure due to severe sepsis from MRSA pneumonia, which prompted admission to the ICU. All right, coders, your time begins now. All right, coders, you all are killing the chat. Yes. Can I clap for you? Outstanding. Do your best. That's all you can do. I love what I see. Do not be afraid to take a educated guess. Don't. You all are doing amazing. All right, my due diligence. Injured his toe. Red, swollen, warm to touch, purulent drainage, shortness of breath, shaking, chills, faint rales in the lungs, left lung, 101 degrees, that's high temperature, positive for MRSA, decreased urinary output, lower extremity swelling, increased shortness of breath, acute renal failure due to severe sepsis from the MRSA pneumonia. Here's my inventory. I didn't do a great job. A lot of the things were integral, but this patient had an injured toe, red, swollen, warm to touch, purulent drainage or pus, shortness of breath, shaking chills, MRSA positive, decreased urinary output, lower extremity swelling, acute renal failure due to severe sepsis, MRSA pneumonia. All right, I'm going to eliminate injured. Ooh, okay, I'm going to eliminate red, swollen, and warm to touch. I'm going to eliminate purulent drainage because both are related to MRSA. Shortness of breath can be related to MRSA pneumonia. Shaking chills, MRSA pneumonia. MRSA positive can be related to MRSA pneumonia, right? But I didn't take it off right now. But decreased urinary output, lower extremity swelling. And I'm going to get rid of MRSA positive because it's related, it's an indicator of MRSA pneumonia or related to it. And injured toe, because that happened several days ago. And he's not here for that injured toe. That injured toe manifested itself into some type of MRSA. So they're not treating it, so I'm going to get rid of it. So that leaves me with acute renal failure due to severe sepsis and MRSA pneumonia. Now, I need to get some guidelines because I don't know what to do. So all of the codes are sequencing sepsis first, and I would sequence sepsis first because sepsis is the reason for the acute renal failure, and that also is related to the MRSA. So I'm gonna go grab the sepsis guideline, C1D1A. Somebody else had another guideline in there, and I'm sure it was right, but it says code the underlying systemic infection or A41.9, and it says do not use R65.2 when coding for sepsis only. All right. I may have pulled the wrong guideline because I was trying to find that guideline that says don't sequence R65.20 first. Don't. That was the guideline I was looking for, and I think the person in the chat probably had it. Okay, but you can't sequence R65.20 first. I'm sure Mr. Sandeep told you that. All right, so we're going to get rid of C, and that leaves us with A, B, and D. I need some more guidance. Yeah. All right, so I'm going to go with C1.D1A III or 111, right? This is sepsis with organ dysfunction. And you code it as such. You're going to code first your systemic organism infection, that A41 point, if you know it. If you don't, it's A41.9. And then second, R65.2 severe sepsis. But look at here underneath, it says never sequence first. And third, your organ dysfunction. So is anything sequencing in that way? A for one, A for one, A for one. I don't see the R65, R65. Okay, so it's next, and then your organ dysfunction. All right, so it's they're kind of sequencing that way. Okay, so I'm getting rid of C because it says never sequence that R65.2 first. I'm moving on. Now I'm just going to look up these codes. I am, and I'm going to hopefully get guidance from the instructional notes and the codes. All right, so if we go to A41.9, This is sepsis due to Staphylococcus aureus. In fact, this is one of those combination codes, but A41.01 is incorrect because this is not MRSA. This is MSSA. Remember, this is susceptible, and susceptible is not resistant. So any answer coding for the MSSA is eliminated. Next, A41.02, this is sepsis due to methicillin resistance. This is indeed a combination code, and this is correct. I like it. I don't like A41.9 because this is an unspecified code. So we're getting rid of A. And the answer is B, and you guys said that all day long. All right, what is J? J15.2, this is pneumonia due to Staphylococcus. Correct. And then you have your R65.2, this is your severe sepsis. And it tells you code first, your underlying infection. That means you cannot sequence this first. R65.20 is the specific code. This is severe sepsis without septic shock. And then we got one more code, this N17. This is our acute kidney failure. And let's revisit the sequencing order. First, you're going to code your underlying systemic organism or infection. That's your sepsis, your sepsis due to MRSA. Your other infection is pneumonia due to Staphylococcus. And then you're going to sequence third, your severe sepsis, and never sequencing first. And then finally, your organ dysfunction. So B does it. And they did it all. All right, so how you coming along? All right, so we're coming down to the wire, and so too am I. All right, so earlier we talked about MRSA. We mentioned MSSA. This is methicillin susceptible Staphylococcus aureus. All right. In other words, MSSA is susceptible to the penicillin or the derivatives of penicillin. There are some guidelines that you should be mindful of, the C1E1A, and its code is B95.61. You probably should have picked that up because we did look at it. This is the code. This is the general code. And also, there is a code for an MSSA carrier. So this means person doesn't have the bacterial infection, but they are a carrier. You use Z22.321.
Thanks for tuning in, and until next time, happy coding!